Here's a review of the male reproductive model from the classroom. And if we start with external structures, we're going to start down here. This is the testes. So this is the male primary sex organ. This area here, this lighter color area would be representing the tunica albuginea, which is that covering, connective tissue covering on the testes itself. It's the deepest layer. And then this structure here would be representing epididymis. And this is where the sperm mature and are stored. Leading out of the epididymis would be this structure here. So we can follow it all the way around. It's going to loop superior and posterior to the urinary bladder, which would be here. And the structure is vas deferens, or ductus deferens. Okay, as it's traveling up through here, it's basically packaged in a structure called the spermatic cord. Okay, and spermatic cord contains testicular artery and vein, and vas deferens, and cremaster muscle is also traveling down. That's skeletal muscle, continuation of internal oblique, as well as nerves and lymphatic tissue. So all of that is kind of bundled together in the spermatic cord through here. So if we follow vas deferens, it's going to travel up, it's going to come around, it's going to connect with seminal vesicle, which would be indicated by the structure right here. Okay? And this would be looking at prostate from a lateral view. Now, if we take this off and we look internally, this is what we're seeing here. So we can see vas deferens is going to travel around. It joins with seminal vesicle to create the ejaculatory duct, which would be a structure that would be here. Okay. And also on this one, it would be right here. Okay. So at this point, ejaculatory duct is going to join with the prostatic urethra, and that's the structure right here. So where is that coming from? It's coming from the urinary bladder, which is the structure right here, and it's traveling through the prostate gland. So this would be prostate gland. It's located inferior to the urinary bladder. So here's prostate gland. And this is the first part of the urethra. And again, that's called prostatic urethra. So at this point, we've got ejaculatory duct joining in with prostatic urethra. And now we have a common passageway for urine and sperm to leave the body. Okay? Urethra is going to continue. At this point, it's going to pass through the urogenital diaphragm, and it changes names. So at this point, it's called the membranous urethra. And we can see on either side, we see these little kind of white circles, and these are representing the bulbourethral glands. And urethra is going to continue, and at this point, it's external to the body. Okay, so urethra is going to continue out through the penis, and this portion of the urethra is called the spongy urethra. So it's going to be heading out external through there. Okay, a couple other things. If we look at the penis and cross section, remember in class we talked about two muscles that are located in the penis. The muscle that surrounds the urethra would be corpus spongiosum. So that would be represented here. Okay, this muscle here, it's actually technically on the dorsal aspect of the penis, but it's this muscle here, and this would be corpus cavernosum. So that's the other muscle that's located in the penis. Okay, just to remind you too, this would be rectum, and then here's anal canal as well on this model.